Hi, everybody. Welcome to our game called Clinic Countdown. This is Robin Andrade, and I am joined with Haley.
Hi.
So, our introduction to Clinic Countdown. The main goal of our game is to determine the correct diagnosis and the correct medication for a patient in a board game format. To start the game, the team will actually need to work together. So there will be 4 players needed. You can't play with anybody, any group less than 4. The game is turn based. Players will have about 20 turns to get them through the game. And the turns are also timed, and all decisions must be made within 1 minute. So you'll get to see the board in just a few slides here, but our board setup, it's important to note where everyone will start on the board. And like I said, you'll get to see where that will happen in just a few minutes. The patient is our white piece, and they will start in the emergency room. The nurse is our pink piece, and they will also start in the emergency room. The radiologist is the black piece, and they'll begin in the doctor's lounge. There's an imaging technologist, and that's the yellow piece, and they'll begin in the imaging room. And the pharmacist, the blue piece, will begin in the pharmacy. So, a little more detail about our players. Each player has a role. So, if you're playing as the nurse, there are a few rules that need to be followed. A nurse can only do certain things, as well as the radiologist, the imaging technologist, and the pharmacist. Each role cannot do all of the same things. So, it's important to keep track of these with our player cards, and those would be given out at the beginning of the game so you know how to play within your role. The nurse will be able to resolve a crisis going to the place where there is a crisis. So if there's a crisis on the board, which you'll see in just a minute, the nurse can go there and resolve the crisis. The nurse can also administer drugs, and they must be in the same room as the patient to be able to administer drugs. They can also view verbalized symptom cards. They are the only person who can view these verbalized symptoms cards, which will be shown to you in just a few slides as well. They have to be relevant or irrelevant. If you decide that if it is irrelevant, if you decide that it's relevant, you can use it, and if you decide the symptoms irrelevant, you can discard it. You can share this with the team if the information is important, and if not, you don't need to share it with the team. The radiologist, so they may order the imaging test. So the imaging test will also be shown to you in just a few slides. And this is what an x-ray will look like, or MRI. So some kind of like imaging to help everybody figure out what is going on with this patient. They'll need to see what internally is happening. So you can only order these imaging tests when you're in the doctor's lounge. You must be the one to diagnose at the end. So it is up to you as a radiologist or the doctor to do the diagnosis, and you must be in the same room as the patient to do so. And you can only view the imaging symptom cards, as you're the one who's to perform the diagnosis. You can only look at those cards. You can send the imaging technologist or the nurse anywhere in the hospital anytime if you require more information. And you may also override any decisions that the imaging technologist make if they've chose something incorrectly, because you can override the decision because you are the physician. You have the answer key to the imaging symptoms as well. The imaging technologist is the one who will take the x-rays or the MRIs. You must perform the imaging test before anyone can look at the imaging symptom card. You must refuse the radiologist's order if you believe that the imaging test is ordered incorrectly. If you fail to do so, everybody might lose a turn. So there are these little snags in the game where if something's done incorrectly, people can lose turns. However, if you refuse incorrectly, no turn is lost. So you can make a mistake, and in that case, if you do, your turn won't be lost. And you must be in the same room as the patient to perform any kind of procedure, of course, because you need your patient to be in the room with you when you're doing that. The pharmacist. So you can view the contraindications and drug interaction hint cards, which will be shown in just a second. You may prescribe the medication, of course, because you're the pharmacist. You want to be the one who's going to prescribe. You are the specialist in this realm. And you will also announce the verbalized symptom card out loud. You may prescribe a medication. You must be in the same room as the nurse because the nurse is going to be the one giving that medication. And if you prescribe the wrong dosage or fail to recognize a contraindication, everybody will lose a turn. So up next is our board game. So I did discuss what colors are at the beginning and what color each role is. So you can see here that the black, for example, the black dot is the radiologist and he's beginning in the doctor's lounge, and the white is the patient and the pink is the nurse, both beginning in the emergency room. And you will rotate around the board um, in any direction that you see fit, and you will be using a dice to do so. Okay, this is our card setup, and I am going to just quickly review these pieces. So we did discuss a lot of cards in the past few slides. So moving into the various cards I did discuss. First, when you roll the dice, the first turn that you take, you're going to pick up an illness card. The color on the illness card will also determine what symptom cards you will play with. So the illness card, say the illness is has a pink dot on it, you will play the pink symptom cards. Also, the patient card will also be linked to the illness card, and it's all linked by color. Since there's different illnesses and different symptoms to go with the illness, it made the most sense for us to use these color variations so the players have a visual cue of what cards to use. Okay, so looking at turns, we have 1 minute. So you'll start your timer on your phone for 1 minute. You'll then roll your dice, and that will determine the number of steps you can take within the hospital. So if you're the pharmacist starting in the pharmacy, you roll the dice, it's a 2, you move 2 steps. From here, you'll take a card if you pass through a card box. So you'll see on the bottom underneath the take a card spot here that there is an event card, a verbalized symptom card, or an imaging symptom card. So this is where you will pick up one of those cards. At that time, you'll then decide which player will move, in that room, and which the dice will roll will be determined from that action. From point 5, it's action or no action. You can choose to take an action or no action. This will be explained in a few slides as well. And you have to do this all within a minute. So it's quite a bit of work, but if you don't, the turn counts regardless of what you would have liked. Everything will be as is when the timer runs out. So whatever decision you've made, you have a minute to do so. If you haven't made a decision, then it remains as is before you rolled.
All right, so I'll be discussing the cards and the details about each cards. So we have 3 different symptom cards. One of them is a pharmacy card, and this has all to do with what the pharmacist does. So once the pharmacist administers the drug and decides on the dosage of the drug, then you'll be able to use the pharmacy card to check if the pharmacist was right. And if the pharmacist was correct with the dosage and everything, then as a team, you guys gain 3 turns. So that's what the pharmacy card is about. There's also event cards. Most of the event card has to do with the nurse and what the nurse is required to do. This kind of throws a little randomness in our board game. So when you draw an event card, it's likely gonna throw a loop in your plans. So the nurse is gonna have to go somewhere on the board that you did not intend to have the nurse at, most likely. So this event card really throws kind of like a little damp in your plans. So we'll go, and then verbalized symptom card is kind of the card that the nurse looks at. So only the nurse is able to look at these verbalized symptom cards, because the nurse is going to be the one sitting by the bedside, talking to the patient. So they'll be the first line of healthcare worker that will know what the patient is going through. So when the nurse draws a symptom card, he or she can decide to share that with the rest of the team or not share it with the rest of the team. And if she or he chooses to share that with the rest of the team, it counts as a turn. So that's the verbalized symptom card. And the imaging card, there's a couple of steps that you need to take in order to draw an imaging card. So first, the radiologist has to put in an order for an imaging test. They need to specify the area of the body that they want the patient to be imaged at. And then the patient, which, by the way, the patient is a NPC in our game. So the patient doesn't have a player role, but they are a character that will be moving around the board, and the team will decide together where the patient is going to go. So the patient must be in the imaging room with the imaging technologist in order for us to be able to draw an imaging card. And then the radiologist is the only player that is able to look at imaging card. So some of the learning outcomes we have for our board game, we wanted this game to assist students to foster problem solving skills, strategy building, critical thinking capabilities, and we also wanted to build some sort of teamwork within the team, and also have them understand kind of interprofessional aspect of taking care of a patient. So through this game, the students will learn to create and apply treatment plans, examine patient-specific factors, and identify contraindications for each antibiotic or diagnostic test. So our board game is really all about antibiotics and how to treat for them. So our illness card specifically are designed to treat illnesses that can be treated with antibiotics. So, what do you think? Like, does our game encourage choice? Does it meet the learning objectives that we set out? Does it encourage collaboration? Does it simulate real life? Hopefully, the answer is yes. And I can kind of talk about the beta testing we did. We actually performed a beta testing over the past weekend, and a lot of the beta testing involved explaining the rules of the game. And then it took us about half an hour to run the game all together. And some of the feedback we got was about the board game, space and rules, and the player rules. So one of the major things about our board game was, if we can go back to the board, there were a lot of uneven spaces within the board. So, which meant that when the players rolled the dice, they had to take that number on the dice around the board. So at first, the players were a little bit confused with the arrow and what that meant. Like, is this does this mean directionality? And I just said, no, it doesn't necessarily mean directionality. It was more of an artistic effort, but it really confused the players. So in next iteration, we'll probably get rid of the arrows. And another thing we would do is we would make each of the squares around the same size, because right now, because some squares are bigger than others, it meant that players, when they were turning around, they would take one or two steps, but they would go around the board and end up in the same place for the intentionality of the game, which kind of defeated the purpose of making the game a little bit more challenging with the dice roll. So that was one of the feedback we received in regards to the beta testing. And another one was regarding uneven player roles. So we realized that a lot of the emphasis on the game was placed on the radiologist and the nurse, and they played a very major role because they were the ones looking at verbalized symptom cards. They were the one making diagnostic decisions. On the other hand, the imaging technologist and the pharmacist had a smaller role to play in the aspect of winning the game. So that kind of made it uneven. And another thing was it was really difficult to make sure that all the players understood that patient didn't wasn't a player. It was the patient was just a character in the game that the players as a team could move around. So those were two major themes that we learned from beta testing. So this is me and Robin. We were the creators of the game. And I thank you guys for watching and listening.
Thank